To get to the comprehensive assessment, you will need to click the arrow next to Visit Assessment, and then click Comprehensive Assessment. You will get this pop-up box asking you to choose a subtype for your visit. Remember that visit and timesheet are synonymous, so you're creating the subtype for your timesheet. Click on the drop-down and select Comprehensive Visit. If you are an RN, it will say RN Comprehensive. Click Yes. After a moment, the form will load. If you look in the bottom right corner of your screen, you'll see a small box that says Form Sections. If you would like to view this in a larger format, hold your mouse over the gray bar until you see a black cross, click, and drag up. Any section that you see that has a red exclamation point is going to be required. Each required section will have red text next to the field that makes it required. Once this field is completed, the red exclamation point will turn to a green check mark, and you will know that you can move on from that section. The first section of the comprehensive assessment is the visit summary. Here, you can enter who was present during the visit, as well as any barriers to communication or education identified. If you scroll down, you'll see that the primary diagnosis and comorbidities are required, but they have pulled forward from the admission assessment. To navigate to the next part of the assessment, you can click Next Section, or you can choose the next section from the Form Section box in the bottom right of the screen. The next section, Suspected Infection, will ask if the patient has a current or suspected infection. Answer based on your assessment. If you click No, feel free to enter a comment. A comment is accessed by clicking on the chat bubble to the right of the field. You may choose the infection precautions if you wish, but as you can see, that text is not in red, so that is not required. The next section, Imminent Death, will ask you if the patient is near death. If the answer is yes, you will need to enter a comment indicating that the patient is imminently dying. If the answer is no, you can select No and move on. You may see links on certain parts of the form sections. These links will take you to forums on the internet that provide education for yourself or for the family. The Vitals section has text boxes that are free text. You may enter numbers, words, or symbols in these boxes. If you come across a text box and you would like to make it larger, click on the magnifying glass to the right of the text box, and this will give you a larger box in which to type. If you scroll down, you may enter any of the measurements that you may collect during your assessment. The mid-arm circumference is only required at the first visit of each month. On the medication assessment screen, the first thing you'll see is a number and indication for PRN doses since the last visit. You can enter these as a narrative, or you can enter them as a list, but it is important that you enter any and all PRN doses that have been reported to you from the patient or their caregiver. Note that CLM stands for concentrated liquid morphine. Below that text box, you'll see the medication assessment in red. You have to select which type of medication reconciliation you have done during your visit. Below the medication reconciliation is SMIC and BIC education. If you have initiated anything from the SMIC or the BIC, or you anticipate that you might, you should provide anticipatory education. If you are not initiating anything from either kit, you can select No. The next section, pain, is going to be required. You have to ask the patient if they are having any pain, and if the answer is no, the question then becomes, is pain an active problem for the patient? This is determined by the use of PRN medication. If the patient is on pain medication for any reason, then pain is an active problem for that patient. The most important thing to remember is that if you select yes to either question, you do have to fill out a self-reportable pain scale or one of the pain scales below. For the purposes of this example, we'll do a self-reportable pain assessment. The self-reportable pain assessment is a Jump 2 form, meaning that it is a form separate from the assessment. The first section of this is the pain area. Click on the drop-down. This is going to open a body. You must select on the body where the patient is having pain. You'll get a second pop-up that allows you to customize where this pain is being felt. Click OK, and then click Select. Your pain area will fill into that drop-down box. To complete the pain rating, we use something called a wizard. Click on the wand, and you'll go through and answer each question. Once you've reached the end, you'll notice that the next box is grayed out and does not allow you to go further. Click Save. Your sentence has now been entered into the pain rating box. For the remainder of the Jump 2 pain assessment, you may select checkboxes. If you have additional comments to add, scroll to the right and click on the comment chat bubble. In effects of pain, you will be assessing what the patient is reporting the pain does to them. Under Observations, you will choose what it is that you have observed as a result of the patient's pain. Below that, there are a few optional questions. The first is the patient willing to change their pain treatment? The second is, have you notified the physician? The third is, have there been changes in the pain since the patient was last assessed? And the last is, have pain interventions been effective? If you click Next Section, you will go to a section that allows you to say what the patient has reported helps them with their pain. Under Physical Help, you have things such as medication, sleep, movement. Emotional helps would be things such as humor, music. And then Spiritual helps involves things that the patient may do from a spiritual aspect that help them with pain, such as prayer or therapeutic touch. Once you have completed the pain form, you may sign it, as this is separate from the assessment. You don't have to. You can sign all of your documentation at the end of your visit, but if you would like to, you may sign now. When you sign a form, everything at the bottom grays out, and all you can do is X out in the upper right corner. The final required section at the top part of the comprehensive assessment is dyspnea. If you choose yes, unable to respond, or dyspnea observed, you will be presented with two wizards that you will use to assess the dyspnea that you are observing or that the patient is reporting. If you select no, you will not get those boxes, and you can click Next Section. The physical assessment snapshot is a blank screen. Click Next. No part of the physical assessment outside of bowels will be required. This is because you may not assess every system at every visit. It's very important that you do take credit for what you have assessed, however, and that you check off the boxes if you did indeed observe these systems. If I would like to add a comment to any of these assessments, I will click the comment chat bubble and enter a comment. Comments are helpful for being specific about your assessment, as some of the checkboxes can be general in nature. Each body system has a section on the physical assessment. When you are practicing, go through and pretend like you are assessing a real patient. This will allow you to get used to clicking around in Suncoast as part of your assessment. Oftentimes, bowels are required in the assessment. Select when the patient had their last bowel movement, their bowel sounds, and any bowel regimens that they are on. You may also select at the bottom any bowel contraindications that may be occurring. The last section of the comprehensive assessment that's related to the physical assessment is endocrine. Below that, we have devices. Under Devices, at the top, you will see an orange button that says Infusion/Vascular Access Form. This will take you to a separate form that you will use to assess if your patient has any type of access or infusion. Otherwise, the devices located on this section are anything that may be in that patient's body, such as cardiac devices, GI devices, catheters, and any stents or drains. Below devices, you have oxygen. If the patient is using oxygen, you must chart it at every visit what type of oxygen they are using, as well as how much and how often. As a note, if you chart that the patient is on oxygen, it must be on their treatments. That will be covered later, so you don't need to worry about it right now. It's a good thing to keep in the back of your mind. Below oxygen is the eligibility support. The eligibility support must be completed at every comprehensive assessment. This is going to be a short narrative detailing why the patient should still be on hospice. If you scroll to the bottom of this section, you will see all different reasons for why our patients should still be receiving hospice benefits. It can include symptom management, clinical status, signs of disease progression, labs, anything that you find relevant for this patient's hospice Medicare benefit should be documented under the eligibility support. Once you've completed your eligibility support paragraph, click OK and move on to the PPS. You can select your PPS from the percentages below. If the patient requires a FAST score, you can check it here. The section after eligibility support is advanced directives. These are completed upon admission, but you can change them if something changes throughout the course of care. Time of death plans is a section that allows you to put in any patient preferences for time of death. It allows you to verify the funeral home and talk about funeral arrangements with the family and the patient. Bereavement is a section that allows you to discuss the future of the patient's caregivers. This may include past experience with loss, the survivor's ability to cope with those losses, as well as anticipated concerns following death. The psychosocial assessment is completed by social workers. The quality of life section allows you to discuss things with the patient such as care needs, anxiety and sadness, values and beliefs for both the patient and their caregiver, as well as to discuss any hopes and wishes. It's important to note that none of these sections are required, and we know this because they don't have the red exclamation point next to them. Just take credit for what you did and what you discussed during your visit. Spiritual history and spiritual assessment are performed by the chaplain. DME and supplies is for home hospice to use only. You can document which DME is already in use, as well as which DME or supplies may be needed. The next section is safety. There are two types of safety assessment forms. The first is for home hospice. The second is for the IPC. We'll click on the safety assessment form for home hospice. This will open another Jump To form. As you can see, there are several sections of this form that are required. Go through and answer all required questions. If the patient is on oxygen and is smoking or vaping in the home, you must notify a physician. If the patient is not in the nursing home, you can skip the next section. You may also skip fall risk unless the patient has a risk of falling. The suicide screening is a very important part of the assessment. You must ask all required questions. If the answer to 1 and 2 are no, you may skip to the bottom. If either answer is yes, you must answer the questions in the middle of the assessment. The next section of the safety assessment is education provided. You may choose any of the selections under Education Reviewed, or you may select Other, scroll to the side, and enter a comment using the comment chat bubble. The final section of the safety assessment is intervention. If the patient is on oxygen, you must review the instructions with the patient. If they are not, you may select NA. Once you have completed this form, next section will gray out, and you have the choice to sign the form or to save the form. The next section of the comprehensive assessment is HA supervision. As RNs, you will be supervising hospice aides. If the patient is currently receiving personal care, click yes. If they are not, choose no. If you choose yes, you will have several other required questions that you must answer. Click Next Section. This section is for GIP justification. If your patient requires GIP care, you may need to fill out this section. Follow the text boxes and be detailed. The summary section of the comprehensive assessment gives you text boxes in which you should summarize your visit. Under Collaborations, Interventions, and Education, you want to write a paragraph detailing what you did during your visit. Start from the moment you arrived at the home all the way through when you ended your visit. If you need more space to type, remember that you can click the magnifying glass and it will give you a larger box. Once you have completed this field, click OK. If you provided any education, you may choose if the patient and caregiver verbalized understanding of said education. If they did, put who you provided education to in the text box below. Recommendations and plan are going to be a short sentence or two regarding what the future plan is for this patient. Below recommendations and plan is who the plan of care was reviewed and approved with. You almost always will choose patient/PCG, but choose any other team member or community member with whom you reviewed and approved the plan of care. Scroll down. The best way to contact the primary caregiver for updates will pull forward from a previous assessment. If it has changed, you may select a new text box. If the patient needs GIP, you must select if you offered and transferred the patient or if you offered but they refused. And below that, you must select if an addendum was furnished. The final section of the comprehensive assessment is the referrals page. RN case managers may refer to massage therapy, music therapy, or request a physician or the IPC intake specialist. Only social workers may request a volunteer. There is no next section on the comprehensive assessment, so at this time you may either save your assessment or sign your assessment. If you get this pop-up, it's data that was pulled forward from another assessment, and you may click OK.